it's really important to grow home-based palliative care. And I'll give you a story about my own father. He's a 96-year-old professor of electrical engineering at the University of Wisconsin in Madison for 50 years and had advanced dementia. And during COVID, he fell 3 times, got hospitalized, did not have access to home-based palliative care, any kind of home-based service. I actually flew to Wisconsin from New York 6 times to take him home from the hospital and all of that. And he was very sick and dwindling, and we enrolled him in hospice care in Madison, Wisconsin. And I realized that was going to be very hard to manage long distance, so I flew him to my dining room in New York and brought him there into hospice care at home. It turns out he actually got a lot better. He enjoyed the activities. He suddenly got hungry for matzo ball soup and liked having my 5 children and my dog around and my husband, so he woke up and was actually discharged from hospice 3 months later. And we were fortunate to be able to enroll him in a home-based medical care program that had very strong palliative care physician support. And he got wonderful care in my dining room for a year and never once went to the hospital, which was consistent with what his goals were and what my goals were. And I contrast that with my mom, who was in her lazy boy chair and reached over for some See's chocolate. She really loves nut clusters. And she bumped her head on the nightstand and got a little bruise on her temple. And I was visiting her that afternoon. I saw the bruise. She likes Burger King. I brought her a Whopper with cheese. She devoured the whole thing. We went walking. And later that afternoon, she was fine. I get a call from her cardiologist and internist who says, your mom has a bruise on her head. We need to send her to the ER for imaging and observe her, and maybe she fell. I said, well, she actually is quite fine. We just were there. She ate a Whopper. We walked around. We actually played Rummy Cube. It's a bruise because she likes nut clusters, and she just bumped her head. We got to put the nut clusters higher up so she's not bumping her head. So, of course, she went to the ER. I couldn't protect her from that. Spent the night in the hospital, sent home the next day, all for a bruise on the head. And I bring this up because if she was in a home palliative care program, a really wise palliative care provider would have said, this is a bruise, I'm going to examine you. I want to really protect you from the hospital. You're 90 years old. It's not what you want to be in an ER or a hospital. We'd want to protect you and really think about how do we keep you healthy and home. And so I just bring up those 2 examples because my father had access to really amazing home-based palliative care where my mom isn't eligible yet for that. And of course, the path of least resistance is to go to the hospital.